Rheumatoid arthritis is a disease which the cause of is unknown. According to the NIH and the Arthritis Foundation, it affects about 1.5 million people in the United States. It is a disease that most people don't know a lot about, so I hope to be able to educate you more on it. Rheumatoid arthritis is an autoimmune disease. This is when the body's immune system starts attacking its own cells and tissues. In the case of arthritis, the joints are attacked. The Arthritis Foundation states that this causes inflammation that causes the tissues around the joints to thicken, thus creating swelling and pain. They also state the joint effect is symmetrical, meaning that if one knee is affected, generally the other one is as well. Arthritis is considered a systemic disease because it can affect the entire body. It is believed that genetic disorders and environmental factors are the cause of the disease, but not yet proven. Many genes have been studied to see what can affect the disease, and many of the genes that are known to have an effect are involved in the immune system function. The Arthritis Foundation states that these gene changes or variations are most likely focused towards the HLA gene complex or human leukocyte antigen. These genes help the immune system figure out which of the proteins in the body are the person's own proteins or are foreign proteins. Due to these variations, the immune system is not able to tell the difference between the proteins in the body, therefore attacking them. With rheumatoid arthritis, there is no proven inheritance pattern. It is not very clear how a person develops this disease. It can be caused by environmental factors such as long-term smoking, occupational factors like dust or fibers, bacterial infections, and viruses. It is, however, shown that a person who has a close relative who has rheumatoid arthritis is more likely to be diagnosed. As I stated previously, 1.5 million people are affected with rheumatoid arthritis. 3 times as many women have arthritis as men. It can occur between the ages of 30 and 60 in a woman and occurs later in life for men, according to the Arthritis Foundation. But kids can get arthritis as well. According to the American College of Rheumatology, 1 child in every 1,000 children develops some type of arthritis. Nearly 300,000 children have been diagnosed within the United States. Arthritis is a hard disease to diagnose in adults, but especially children. Because they are so young, some doctors won't test for arthritis, making it very hard to diagnose. There are a few things that can be done to test for arthritis. These tests are the same for both children and adults. Doctors can take blood samples to test for the presence of certain antibodies that would indicate the presence of arthritis. These antibodies that are present in people with rheumatoid arthritis are called the rheumatoid factor and the anticyclic citrullonated peptide, or anti-CCP. If these antibodies are present, it is a strong sign the person has rheumatoid arthritis. Imaging, such as X-rays, can also be done to see the level of deterioration in the joints. Treatment for arthritis can be tricky. There are many different medications that can be used as treatment, but it all depends on the person being treated and their reactions to the medications. NSAIDs are used for pain relief and used for anti-inflammatory aspect. Disease-modifying anti-rheumatic drugs, or DMARDs, are used to try and slow the course of the disease, according to the NIH. A big DMARD used to treat arthritis is called methotrexate. Biologic response modifiers are used in people with more serious cases. These medications tend to be given intravenously. It is also very important that people with arthritis have a healthy diet and get plenty of exercise. This helps to reduce the stiffness in joints and can actually relieve some pain. Rheumatoid arthritis is a tricky disease that not a lot is known about. It is difficult from trying to diagnose someone and to then trying to find the right treatment. It is complicated, but with the science and technology in the world now, I hope a cure is in the near future.